Hello, this is Lauren Waltz. I'm the PA for Dr. Black and Dr. Liu at Anderson General Surgery. Today we're going to talk about myths and facts of bariatric surgery. So let's get right to it. Alright, myth number 1. Everyone always wants to know if they're going to have hair loss after surgery. Now, most of our patients do not experience hair loss after surgery. Some people do, and this is not due to a vitamin deficiency, but it's actually a result of a shock to the system. Even though it's a good shock, some people's bodies will respond with hair loss. The good news is that for most people, it's not noticeable, and for those who do experience it, the hair will actually grow back how it was before after they have finished losing weight. All right, myth number 2. Bariatric surgery causes me to lose weight too quickly or lose too much. So the fact is, if you eat 3 high-protein meals a day and exercise 4 to 5 days a week for 45 minutes at a time, you will lose the weight in a healthy manner. Throwing up after the surgery is not common, and if it is happening, you need to call your doctor immediately. 1 to 2 pounds of weight loss a day for the first 2 weeks after surgery is common. After that, it'll slow down, and most people plateau above where they need to be. If you work extra hard, you can get it down to your ideal weight. The weight loss does not actually continue past your ideal weight, so you don't have to worry about that. Myth number 3. I can't drink from a straw, eat anything with seeds, or chew gum after surgery. We always hear this a lot, and these are just not true. The other one I can add that's not on the PowerPoint is gummy vitamins. You can have any of these things. You can find them all over the internet, and actually some medical doctors even tell their patients this, but they're just not true, and you can do any of these with no problem. If you have a question about it, you can also just call our office and ask and make sure that it's okay. Myth number 4, weight loss surgery is dangerous. So we have some information here about this because the risk of living with morbid obesity is actually higher than the risk of having advanced weight loss surgery. So patients who have had weight loss surgery are actually 56% less likely to die from coronary artery disease, 92% less likely to die from diabetes, 60% less likely to die from cancer, and there's more to that, but that's kind of the main ones. People who weigh twice their normal body weight are actually 10 times more likely to die than somebody with a healthy weight. And then the other thing is that our gastric leak rate is 1/4 of the national average, which means that we're actually very safe with our surgeries. The mortality rate for a gastric sleeve is considerably less than most other operations, including gallbladder and hip replacement surgery, and the chance of dying from the operation is exceptionally low. The benefits of bariatric surgery with regard to mortality far outweigh the risks. Myth number 5. I will need to take handfuls of vitamins after bariatric surgery. So the truth is, before and after surgery, patients are advised of their dietary and supplemental needs, and followed by a nutritionist with bariatric expertise. The only vitamin we recommend after a gastric sleeve is a regular multivitamin. We check your labs at 6 months, 1 year, and yearly after that. Vitamin deficiency from this surgery is very rare and typically only happens in patients who leave out complete food groups in their diet. All right, myth number 6, weight loss surgery is a cop-out. We have a lot of patients who sometimes come in and they say that their friends are saying that they're taking the easy way out. But the truth is that 8 out of 10 dieters actually fail to maintain weight loss more than 2 years. The larger a person is, the less likely that they will maintain weight loss. Bariatric surgery may be the best option for many morbidly obese individuals who to be able to achieve permanent life-changing weight loss. The gastric sleeve is a tool to help you make the changes, but the surgery will not lose the weight for you. Myth number 7, most people gain their weight back. So as many as 50% of patients may regain a small amount of weight, approximately 5%, 2 years or more following their surgery. However, longitudinal studies find that most bariatric surgery patients maintain successful weight loss long term. Such massive and sustained weight reduction with surgery is in sharp contrast to the experience most patients have previously had with non-surgical therapies. Myth number 8, nuts are a great snack. So while nuts are great protein, they're also very high in fat and calories. So if you want to snack on nuts, make sure that you count out the number of nuts that add up to under 100 calories. Your snacking calories for the entire day should not go above 100. Otherwise, you can have a few with your meal on a salad, for example. Myth number 9, you need to have 2 weeks of liquids before the surgery. We hear this one a lot too because some programs actually still do this, but our program, we only use evidence-based research for our program. Studies have now shown that there is no reason to have 2 weeks of liquids before surgery. In fact, people who do a 2-week liquid diet before their surgery are less likely to comply with the 2-week liquid diet afterwards, making it extremely dangerous. Myth number 10, skipping meals will make me lose more weight. So in truth, studies have shown that you need to eat 3 high-protein, low-carb meals a day for sustained weight loss. If you skip meals, your body will go into starvation mode and hang on to every calorie you eat. If you eat 3 meals a day, your metabolism will be increased and your body will burn calories at a regular rate. So when it comes to myths, there's many circulating around. In general, if it doesn't make sense, it's probably not true. If you ever have a question, make sure to always ask us. The internet is a great tool, but it also is full of misinformation. Your friends and family support are great, but for medical advice, make sure you follow what your bariatric surgeon has told you. And that completes our talk.
Thank you.